All Children's Hospital in St. Petersburg is one of only 2 freestanding pediatric hospitals in the state of Florida. It opened a brand new facility in January of 2010. And more recently, All Children's earned the distinction of becoming a member of Johns Hopkins Medicine. Very impressive. Joining us today, Dr. Chad Brands, who's Director of Medical Education. Bill Horton, Senior Vice President, Strategic Business Services, and Dr. Neil Goldenberg, Director of Research. Gentlemen, thank you all for being here today.
Thank you.
Bill, I'm going to start with you because you've been there forever. You've been there more than 30 years.
Time.
Yeah, you have, and you've served in different capacities.
Yes.
And so how have you seen the hospital evolve over time?
Oh, it's just been a tremendous growth effort and growth curve that we've experienced. But it's always remained a very mission-driven institution, and as what we developed our clinical prowess and preeminence along the west coast of Florida and then throughout the state of Florida, we realized that we needed an equal investment in the research and education missions of our institution in order to be able to continue our position as a community asset and to ensure that our children receive the care that they need locally without having to leave the Tampa Bay area.
I didn't realize the long history of All Children's. It started out as the American Legion Hospital for Crippled Children in 1926.
That's absolutely true, and we weren't incorporated into All Children's Hospital until 1967, and it was really the community commitment at that time to general pediatric care that really kept the hospital alive, because like a lot of hospitals, as what it went through cure for polio and so forth through the 1950s, that was a big portion of the population. But then we grew as what Florida grew, and the west coast of Florida grew, and with tremendous support from the community that we remain continually appreciative of.
And I mentioned as in January of 2010, you opened the brand new facility. Why was that deemed? Yes. And why was that deemed necessary as opposed to renovating, remodeling the existing facility?
Well, just in this day and age, the technological requirements of a healthcare facility just really outstrip the design. Just the amount of space in your ceilings alone for the amount of technology and cabling and connectivity that you need to pull through these days. But we also wanted to achieve a lot of the environmental needs of families when they have a child hospitalized. And so there was a lot of effort that was put in to find even specific areas in the room that were both for the child as well for the family, because we need to support both whenever that child needs to be hospitalized.
Good point. And Dr. Brands, let me ask you about that. So you're not just treating the pediatric patient, you are, in a sense, treating the entire family.
Yeah, we're very excited at All Children's. They've been very patient and family-centric for many decades, as Bill eloquently attested. We're doing this whole training programs and education research. We're going to continue that focus, and we look to lead the nation in terms of patient family-centeredness.
You were at the Mayo Clinic, yes?
I was.
And so, one of the most prestigious medical facilities in the country, well known obviously. What brought you here?
The opportunity. I think the opportunity to do great new things, the integration of All Children's and Johns Hopkins Medicine, I think puts us just in an absolutely unparalleled opportunity. Education, research, and patient care. I think we've got the true ability here to really define the next generation of healthcare science and delivery.
And when you talk about education, that has to mean community outreach, yes?
Yes, absolutely. All those things that All Children's has done go back to 1926, carrying forward into this century and beyond. But we're starting programs for medical students that we hope local students will be attracted to, but also students from around the world. But we'll start with the community and move out to the world.
Dr. Goldenberg, you came here from Colorado, correct?
That's right.
Okay. But it seems to me you did your residency at USF. Am I right about that?
I did.
So something stayed with you about the Tampa Bay area. So when this opportunity presented itself, did you jump at it?
Oh, I definitely did. I was really excited about the opportunity. I feel like for myself personally, it was somewhat of a homecoming. I think the opportunity in research was phenomenal. However, to be able to partner Hopkins and All Children's in focusing in pediatric research, really designed to directly impact the quality of patient care. So for me, it was really a welcome opportunity to come back to the area and contribute to that mission.
Tell me about this relationship with Johns Hopkins and how hard is that to achieve?
I think it can be logistically challenging, and it needs to start with a devotion to the mission and the spirit of cooperation. And so we've seen just really exciting examples of cooperation in different disease areas for clinical care optimization, but also for research in areas such as neonatology, cooperation between the Baltimore and St. Pete campuses, hematology, cardiology, and these will, we think, lead to really more rapid translation of optimizing clinical care and also advancing clinical research for kids.
This can go to any one of you. I'm sure you think that All Children's has many strengths, but if you listed, the top 5, what would they be? What do you do best?
Well, number one, I think, and that's what Neil was just speaking to, is our ability to be able to interact and interweave the missions that we have. And I don't want to leave out our mission of advocacy as well, because I need to remind everybody that our patients are pediatric patients. And so, and while this is all part, and we're excited about the RNC, our patients don't vote. So we continually advocate for what is in the best interest of child policy all the time as well. So I think if I look at its clinical preeminence, it's our ability to interact and interweave these missions together. It's our commitment to really advocating for child health policy. It's our tremendous desire to be able to train the needed future healthcare providers. And I think all of us need to keep to the forefront how important it is to be able to train medical students, but also nurses and also all of the ancillary staff. Because it's not always about just the physician and patient relationship. In the future, now, but more so in the future, it's the team approach towards that care that's going to make the difference.
And with the opportunity to educate children, because they are your patients, the next generation perhaps will be a healthier generation. Yes?
We hope. I think all 3 of us, and I think the whole All Children's Hospital, Johns Hopkins Medicine endeavor is really centered around making healthier communities, but also taking all the things that we learn around the world in the traditional Johns Hopkins medicine.
How many disciplines are there that you're conducting research in?
There's well over a dozen. Every spectrum of clinical care for children is also going to be engaged or has been engaged in research. And I think one of the opportunities we have is to really augment the capacity to conduct that research to bring it to improve clinical care more rapidly.
And you do this in cooperation with other hospitals or within the Johns Hopkins network? You're sharing information constantly.
Exactly, and it works on both levels. So there's some natural collaborations with Baltimore in terms of Johns Hopkins and other hospitals in the system, but also a lot of the subspecialty areas for pediatrics involve networks of collaboration that go nationally and internationally in order to answer questions more rapidly. So we're in a position to be a leader in that endeavor as well as a participant.
I'm going to ask for some video. I think we have some video. I could be wrong about that, of the All Children's facility, but I want to tell you some of the numbers here, which are quite impressive. We have 259 beds. 97 of those, and this may be in addition to, are neonatal intensive care beds, correct? You have more than 250 pediatric specialty physicians, nearly 10,000 inpatient admissions, and more than 42,000 emergency center visits. That's a considerable body of work, is it not?
It's a lot of fun. We really reach throughout the state, and we've actually drawn patients from all 32 states and about 15 foreign countries. So All Children's reputation has grown substantially over the last 20 years.
And is there a primary reason that people seek out All Children's? Well, quality of care, obviously, but are there certain specialties over and above others?
Well, there most distinctly are certain core programs that we have focused development on, and they're really the combination of multiple specialties dedicated towards the cardiac care, for example. You have both surgical as well as medical specialties, and then subspecialization. I think what a lot of people don't realize, and the old man of the group here, will...
You're a youthful-looking old man.
Well, I appreciate that, but the reality is that, in the 1980s, I would have been going out and recruiting for a pediatric hematologist oncologist. These days, you're recruiting for pediatric neuro-oncologist and pediatric sarcoma specialists and pediatric hemophilia specialist. And it's all a matter of subspecialization within each of these specialties in order to be able to care for these children and children's diseases.
So what has changed? Those diseases are becoming more prevalent, or they're just simply we're not the specialists in those?
The body of work that these gentlemen represent has just grown so tremendously that you really need to be able to narrow down their subspecialty concentration based upon how treatment and knowledge of those diseases has advanced.
Dr. Brands, for example, kids, we don't think of kids as having cardiovascular problems, but there are children, I guess, who have cholesterol issues.
Sure.
Yes.
There's a whole range of services that All Children's has developed, primarily to really benefit those children and their families, all the way out from preventive cardiology, all the way out to correcting cyanotic congenital heart disease. But All Children's has developed a fantastic reputation in cardiovascular services.
And so kids are evaluated, and hopefully, in most cases, surgical intervention isn't required, but through medication or diet changes or whatever, you can address these needs.
Sure. Lots of primary and secondary preventative services are offered. Attention to diet, exercise, promoting healthy communities. Lots of primary preventive interventions.
Dr. Goldenberg, how much has research revealed about, especially when it comes to, for example, cancers, that it's the hand you're dealt, that you're predisposed? How much are we learning about that with children?
I think we're learning that with a variety of diseases, cancer, blood disorders, a whole host of others, that it's a dynamic interaction between genetic predispositions and environmental factors. And so the research that we're conducting today and in the future needs to address both sides. I think we're in a wonderful position with some strengths in Baltimore, some strengths in St. Petersburg to be able to address both sides of those issues. And I think one of the underlying principles that we've learned recently about children and children's diseases are that they're much more complicated than they used to be. You have areas like thrombosis and stroke that lie between subspecialties, and that gets back to Mr. Horton's point, where you really need to bring to bear the cooperative spirit of all these different subspecialties to have a disease program that will best serve the child. So that may be hematology, cardiology, neurology, all working together, and we've really taken a multidisciplinary approach with clinical care, research, and education. And that's really what's needed today.
When you say stroke and you think of a child, no, there's no way. But it does happen, right? It does happen.
It does. In fact, the most frequent time to have a stroke, the most highest incidence is actually when one is born, not when one is 85.
Incredible.
So as we appreciate these things in pediatric care and as we get more successful in treating diseases, we also have other complications of diseases where we need to be as expert in the management.
So many advances have been made in the NICU. And when I say that, so many children, or too many, I'll say it that way, are born prematurely and are a pound or less. And 20 years ago, their chances of survival were next to nothing. But great advances in this area, yes? Any one of you can answer that.
Yeah. Jump in, but you know, from a clinical perspective, but without a doubt, our ability to be able to intervene and successfully intervene in children at smaller weight categories is absolutely the case. But when you do that, I think to the point is that it's more than just that incident in and of itself, is that you have to be prepared to be able to support that child then over their lifetime. And a lot of treatments that otherwise save them have sequelae down the line that we're learning about. And that creates new research avenues and new opportunities again to be able to improve their quality of life down the road.
Terrific. Gentlemen, thank you all for joining us. We're going to stay on topic. Did you know that? Yes.
That's right. That's right. Got some
Because
friends over there.
All Children's is also tackling one of the greatest challenges for the next generation, and that would be obesity. Here's Kathy with more on that.